Medications are one of the foundations of modern medical therapy, but they also may have important side effects and interactions. Therefore, it's very important that you know your medications. That includes when to take them, why you take them, and what the dosage is. On this week's Health Talk, one of our favorite and most popular guests, pharmacist Robert Bepko, will discuss medication safety, so please stay tuned. Health Talk is up next. Hello, I'm Dr. Eric Mazer. Our topic today is medication safety, and we're really pleased to have Bob Bepko, a pharmacist, the head of the pharmacy with Nuvance Health. He's joining us today. Welcome to Health Talk, Bob. It's so good to have you back on the show.
Thank you.
This is such an important topic, medication safety. Let's even start with the basics. You're a patient. What should you do to be safe with your medications? What are the sort of the important, fundamental things to do?
It's important that you take your meds when your healthcare provider tells you to take them. That's number one. It's important to take them every day as you're supposed to. And three, you need to be very careful with what you may think is a natural product, alcohol, with taking your medication. Because alcohol is a drug, as we've talked about over the years, and meds are becoming so complex now that we've got to be careful on how we take our meds.
And it's really, there's so many things embedded in all of that. Let's start with, again, some of the basics. Patients see multiple doctors, specialists, different systems. I think patients may be under the illusion that they all link up in a nice integrated healthcare network, or I should say information system. They don't. Pharmacy plays a role in that. Do you want to talk a little bit about keeping your medication straight?
As I just mentioned, it's important that the patient has to assume responsibility for their medications.
I think that's a real key point. But go ahead and emphasize it.
It's your responsibility. We talk about electronic medical record systems. Unfortunately, they don't talk to one another. You've got four major health systems in the state of Connecticut. Everybody uses a different product. Each physician practice, if they're not employed by the hospitals, they're using their own private market electronic medical record. That doesn't communicate.
And so that means, and again, it's really important, I don't think that people really understand this. Your doctor may not have a record of what the other doctor prescribed for you, what the other doctor saw on you at x-ray or did on the EKG. So they really don't, we should have that coordination. I think we absolutely should have it, but we don't.
That's correct. A lot of times, if you go to one health system and get your medical services from that one health system, there's a very good chance you're in good shape. But we don't see people doing that because they'll say, well, I go see Dr. So-and-so for this, and I go see Dr. So-and-so for that, and they're outside of the systems. And so they're not communicating. And it's important, especially with your primary care physician, that physician has to know what everybody has you on. It's critical.
Now, how about the pharmacies? If you use a single pharmacy, do they generally have then a list of all your medicines?
If you have insurance, and that's the critical thing. If you have insurance, you can go to any pharmacy that'll fill that insurance plan's prescription. They'll have a record of you. If you don't have insurance and you're using cash to go to different pharmacies, they will not have a record of that medication. But it's the insurance providers that really do a pretty good job of what you're taking in that electronic record.
So how would I as a patient access that information so I can compare what I am taking to what they think I'm taking?
Right. You can you can go to your pharmacy that you go to. You can request a list of all your medications. You can take that list and compare it to your prescription vials that you have laid out on a dining room table. And then you've got to also make sure that if you're getting prescriptions from a mail order house, you got to keep track of those also. And also now there's another type of pharmaceutical called specialty pharmacy, which comes from a very select network of providers. And these are medications that are have the ability to have narrow, you can have a health risk taking it for the condition. These are drugs that are most of the time are over $10,000 a month. And these are products that your blood work has to be reviewed every couple of weeks to make sure you're not having some serious side effects from the medication. And so you have another class of pharmacy providers that are providing that also. And again, that's why it's critical. You need to take a morning. Gather all your meds, what you think you're taking, write them all down, and have that list prepared when you go see your primary care physician, because they're the quarterback that's sending you to different places for a different specialty need. They got to be kept in the loop.
And we can't emphasize this enough, because I found even when I see my primary care physician and she will list for me the medicines she thinks I'm taking and what I am taking, it's the rule rather than the exception that there are errors in that electronic record. Things that just get continued because you took something for a short term, but it never fell off the record.
Right. I will agree with you 1,000%. It happens, and it's depending upon the electronic record the system is using to have a patient portal. It's a good idea to go in there and check that patient portal. And it's also, if you feel that you can't accomplish that by going in and maneuvering through the portal, I kid around, ask your grandchildren or your children, because they can go in and they can maneuver and they can review all this with you. And it's so helpful.
I know from a standpoint of a physician, knowing the medications that a patient is taking, the doses, how recently, is essential to begin to think about how to care for them. And we have something called, I'm not teaching Bob this, but when someone comes into the hospital, we do something called medical reconciliation. Now we have pharmacists doing that, don't we? To tell patients what that is,
right.
And again, how that's so important.
So what we find now that a lot of people are entering the hospital through the emergency rooms. And so what we have a team from the pharmacy in the emergency room at high peak hours, like from 11 in the morning until 9 at night. And the pharmacy team will interview. We have bilingual people that can talk to our patients in their own language. And we try to gather as much information from them. We'll ask them if they have a list. A lot of people do bring their list in, which helps very well.
That means we're making some progress.
Exactly. And then we have the ability to go in. We'll contact their local pharmacies if there's some question with the medications.
There's one other piece of advice to throw out, and I don't know how often people are doing it today. But we need to know the names of the medicines. A green pill for blood pressure doesn't really help, especially with generics. Green pill could be just about anything.
Exactly.
A water pill doesn't really help us. We can guess, but it doesn't really tell us. So we really need to know the names.
We need the names.
The names and the dosage and how frequently you take.
And you can do it. It's available there. But again, this gets back to the patient responsibility. It's your health, it's your body. You need to know what you're doing.
Yeah, I think someday, hopefully someday, our electronic integration will be sufficient so that we will have an accurate record. But as you said, right now it's still up to the patient. And Maybe say a few words. The number of drugs that are available today are skyrocketing in a good way. There are so many different drugs, different ways to treat things. So we're not dealing with when I left medical school, maybe there were a couple dozen drugs that we dealt with commonly.
And now we're finding that if you look at the age group 65 and over, they're taking approximately 8.2 different meds. And that's, that never happened before. Because again, we didn't have a lot of meds to treat every kind of condition that we have out there that were so successful with the statins that we use to lower people's cholesterol.
And I will say, just as an aside, a lot of the names that are being used for drugs are getting increasingly complicated. So penicillin is an easy one.
Exactly.
Alemtuzumab is not one that slips off your tongue. Writing them down is important. A lot of them sound similar. They have similar sounding names.
But they're not.
They're not.
They may sound similar and they may look similar with the spelling, but they're totally different indications.
Exactly.
And that's the...
Do you want to say, we've got a couple minutes left. I just see endless commercials, now that I'm retired, for supplements. And they're really not marketed as supplements. They're marketed as treated. They're not supposed to, but they imply that they treat inflammation, help your immune system, give you energy, protect your brain. Do you want to say a few words about that? Not in terms of efficacy as much as further complicating our ability to know what patients are treating themselves.
Totally. We're going to have, I went for a walk last Sunday at the Green in the town that I live in, and they were setting up a fair. And somebody was setting up a gigantic booth for CBT oil. And all natural pain reliever, and it's something that we have to be concerned about. It's a product that's derived from cannabis and hemp, and it's not that natural. I mean, it is natural, it's grown from a plant, but however, the active ingredients in these products...
So is poison ivy.
Right, so is poison. That's a good one. So these active ingredients, they have the ability to affect liver enzymes. And so if you want it, and the liver enzymes, as we know, help degrade drugs in the body and you excrete them. So with this oil, it's supposedly helping you as an anti-inflammatory. But people that are taking anti-inflammatories, people with arthritis, they're taking anti-inflammatories, they may be taking pain meds. It also affects antidepressants. And the other thing that I looked on when I was preparing for the show was that it affects levothyroxine. And I would
thyroid hormone.
I would say that probably maybe 40–45% of the population is on a thyroid hormone. And if these natural substances are affecting the liver from preventing to degrade these drugs, you're getting a buildup of the drug and you're going to have a side effect.
Yeah. So the really important message there is not only you have to know what you're taking in terms of prescribed drugs, so you also have to be very honest with your doctor about what you're taking over the counter and supplements. Because natural does not mean benign or no side effects.
That's correct. It's just because it's natural, it doesn't mean it's good.
And that's a good way to end this. We could talk about this a whole other show.
All day.
Unfortunately, that's about all the time we have for today. I want to thank my guest, Bob Bepko, for coming on Health Talk today. And thank you for watching. Please feel free to email us with your questions and comments at healthtalk@newvancehealth.org. Thank you very much.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
Medication mistakes are one of the most common sources of medical error in hospitals today. Each year, the FDA receives over 100,000 reports of medication errors. Norwalk Hospital is promoting safe medication practices by introducing an innovative medical management system by the pharmacy department. On this week's Health Talk, pharmacist Bob Bepko will explain why this is such an important safety measure and what it means to you as a patient. Hello, I'm Dr. Eric Mazer. Our topic today is medication safety, and I'm really pleased to have Bob Bepko, a pharmacist with Nuvance Health, join us on the set. Bob will discuss why safe medication practices at home as well as in the hospital are so important for your well-being, for your safety, and for your satisfaction. Bob, welcome to Health Talk. It's always such a pleasure having you.
Thank you.
And it's always so much fun, and I think it's always so incredibly informative. Now, Bob and I, we've known each other for probably 30 years.
Exactly.
And we were saying, when I was here at Norwalk Hospital, you had an advanced robotic system for managing medicines. And my understanding is now you've taken the next step. Can you tell what are you doing that's so innovative, and why is it important?
So approximately 20 years ago, we were looking for ways to improve patient care. Because that's what it's all about. It's all about patient care. And what we wanted to do was to improve medication safety. There was lots of new technology coming on the market, and we thought, and we proved it true, that by automating the medication picking system in the pharmacy that is sent to the patient's bedside, you could reduce lots of medication errors. Before we had our first robot, which we call Sam, we had a name contest here at Norwalk.
And the best you could come up with was
yes,
Sam?
Yes, we can. And Sam was for safely administering medications.
Oh, okay.
And so before Sam, we would have pharmacy technicians picking medications, putting them in medication carts, and the pharmacist would have to come and check all those medications.
You want to even go through that whole thing, the whole process from order writing to just to give people an idea of how far we've come?
Oh yeah, that's true, how far we come. So circa when Eric and I started here, there was very little automation. It just wasn't in the medical health center, health facilities. So Norwalk was always on the edge with trying to improve things. So we went from having physicians writing orders, paper orders in a chart, putting the orders in a bin, having somebody send the orders to the pharmacy. Pharmacist would write the order.
They'd have to read the handwriting.
Right, read the handwriting, write the order, and on an index card, the nurse would have to do the same thing with her index card. And hopefully you're writing the same drug, the same dose at the same time. And as Eric just said, it was very difficult to try to decipher things with handwritings. So Norwalk went and put a physician order entry system in.
Well, before we leave, that old system, do you have any idea of how frequent medication errors were with that old system? Was it a few percent? I don't remember.
I would say it was a few percent. I would say that.
Which is really astounding when you think of the thousands of orders that may go in a given day.
Right.
You're talking about multiple errors. Good, and most of them were caught.
Right.
But there were multiple errors in that kind of a system.
Right.
Or at the very least, inefficiency. Somebody can't read the handwriting. You got to call the doctor. Doctor,
right.
Did you mean, amoxicillin or something different? Very time-consuming, very cumbersome.
And so, and again, keep in mind we're going back before cell phones, before beepers. Where you had to call the physician's answering service, and the answering service have to track down the doctor and try to get things explained. So we had a system, patient management system that was put into Norwalk, and it was computer order entry. Either the physician, the nurse, the unit secretary, or the pharmacist would put an order into the system.
And they would type it in.
They would type it in, and it would print out at the nurse's station, print out in the pharmacy, and it was a big step, absolutely big step. So the next part of that was that how do we take the human element out of filling thousands of drug orders per day? And we came up with SAM, with our robotics.
Bob, was the pharmacist himself or herself doing that?
Yes.
Or did you have pharmacy technicians?
No.
The point that I'm getting at is pharmacists are pretty bright people. If you can imagine standing all day counting out pills.
Yeah, and you'll see we've transitioned so many people. There's a pharmacist on a floor now working with the rounding medical teams with the patient's needs. But so now we had a robotic system that once the physicians put the orders in up on the floors, it sent a message to the pharmacy. A pharmacist would review that for accuracy and sign off on it, and it would send a message to the robot. The robot would make the big spin, pick out all the patient's meds, depending upon the time of day, either put it in an envelope to send to the floor, or else would put it in its medication cart, and that would be sent to the floor. And so it would take, we did a time and motion study. It took 44 hours per day to process medications, fill the carts, check the carts. Our SAM-1 that we're going to shut off this weekend did all that in 4 hours.
Wow.
So we went from 44 to 4 hours. So
44 hours a day is 7 full-time people
correct.
A week.
That's correct. And so what the nice thing was that Sam never called in sick, doesn't take vacation time. It was just a great piece. And we've kept track of the downtime. And so for a total of 18 years that we've been utilizing SAM, was down a total of 17 hours.
Wow.
I mean, really dramatic. So as all good things come to an end, we reach the end of life with SAM. And so we went out and looked at the marketplace, what was the next best that
Of course,
we could
technology
bring.
has exploded between the time SAM was implemented and the present day.
The total explosion. And so we have a product now that we're calling SAM-2 that doesn't look like our older product at all, is so much more advanced. I will tell you that they ran, we had a team of people overnight when we usually fill the medication carts. And as I mentioned to you, SAM-1 took that 44 hours, brought it down to 4. Well, the new system did it in 2.5 hours.
Wow.
And it's just, it's remarkable.
Now, does the new machine take orders directly from the electronic medical record?
Yes, absolutely.
Because now, the way physicians used to enter orders, it was used to be a written order that the ward clerk or the ward secretary would then, at very best, put into a computer.
So
now physicians are typing those orders in.
Typing the orders right in. It comes into the queue. Once it's approved, the message gets sent to the robot and the products are picked. And so it's a dramatic change of events. And this particular piece of equipment, we don't have to worry about outdates because it remembers what medication you put in, what that expiration date is. So it'll always go to that one med to pick first to use up.
Does it just load up with bulk medicines and
No,
and
no. They come commercially packaged, and you just put the commercially packaged product in the trays, and it comes out and picks
Oh, that's
them.
amazing. That's really the other thing that maybe we could just mention is with electronic prescribing, you finally have a way to feed back to the physician if they're making an error. So the electronic medical record will say, are you sure you want to prescribe this Valium because your patient is also taking this other sedative, and they can, or this patient's taking a narcotic. Are you sure you want to do that? Or did you know that this medicine is directly contraindicated because that your patient's also taking this? That can always be overridden,
Yes.
but those messages pop up, and they maybe you could say more of it, but it really, it doesn't correct bad doctors. We all need that help. It's not a question of being a bad doctor.
Right.
Nobody knows every interaction. We said that before.
And you may have a couple, you may have a physician, you may have an advanced practice nurse, you may have a PA putting orders in on the same patient. You may have an anesthesiologist come by. And again, you got 4 people in the chart writing for things, and the system is there to protect the patient. And it does a very good job.
Yeah, do you have? I remember seeing some data on this even before SAM2, showing a remarkable reduction in medication errors.
Nosedive, yes.
I mean, how frequent now are we seeing
We
true medication errors? Because again, just we said that was the most common source of medical error within hospitals.
we were actually able to go at the time to Lloyd's of London, who was our insurance carrier, and get a lower rate because of the fact that the robot has a 100% picking capability.
And the new SAM2,
Same thing. And you know, so just
but
so
new
the,
SAM2 is much more integrated, it sounds like, than SAM1.
all SAM2 will pick injections, where SAM1 couldn't do that. And so you deliver, you make life nurse easier for the nurse on the floor because you're giving her a container that has the correct medications, and then she'll go and scan the patient's
I was just going to
wristband.
bring that up. How do we make sure that take care of your cough? We can actually make sure that the right patient is getting this medicine using technology.
Right, because the nurse will scan that patient's wristband, and then she'll scan the med, and if that med is not on that patient's medication profile, something's the matter.
So it's really a remarkable rapid revolution.
Rapid evolution.
From a standpoint of writing orders and having people try to remember interactions and transcribe multiple different steps to one where the physician orders it and it's almost completely automated to the
Yes.
point of delivery to the patient.
It's patients should have a very high comfort level with their medications.
Yeah. Well, that's such important, and it's certainly gratifying news. We don't quite have the same technology on the outpatient side, but hopefully we'll get closer and closer to that.
Yep.
But it's really eliminated a major source of medical error, and patients should be very, very comfortable in an institution like Norwalk that has such advanced technology.
We're actually, COVID slowed us down a little bit. This equipment should actually have been in place last year, and in Danbury, the construction's going on now to duplicate the system.
It's really exciting, Bob. Very, very, very exciting what's happening in medicine. Unfortunately, that is all the time we have for today. I want to thank my guest, Bob Bepko, for coming on Health Talk, and thank you for watching. Please feel free to email us with your questions at healthtalk@newvancehealth.org.